Hi there, welcome to the Healing Migraines Naturally podcast. I'm your host, Dr. Leslie Caesar, and I'm a licensed naturopathic doctor, former chronic migraine sufferer, and I've dedicated my life to helping other women with chronic migraines rediscover a migraine-free life. So welcome back to the podcast. If you're new here, I hope you enjoy the content. I think we're coming up on 100 episodes here. Really exciting. If you've been enjoying the content, please give us a like, a subscribe, a comment. It really does help us with the algorithms. So today I want to walk through an article that was just sent out by Migraine.com. I'm on their mailing list, and I've done another podcast on Migraine.com where I talk about, actually I've done a couple reviews of some of their articles, but one podcast, will link it in the notes here, the show notes. I did a deeper dive on how Migraine.com is funded. Okay, so it's funded by the pharmaceutical industry. Okay, so I'm going to talk a little bit about that as we go through the article. One thing that I have been trying to highlight on the podcast. So our dominant system of medicine, which is called allopathic medicine. So this is the type of medicine that's practiced when you go to your medical doctor, your neurologist, even most osteopathic doctors, DOs, most of them practice allopathic medicine. They used to not, but now they predominantly do. Allopathic medicine is based on the belief that once your body starts generating symptoms, once you've been diagnosed with a disease, right, which a disease is basically the identification of recurring symptom patterns that play out across people, right? Those patterns have been identified, given a name to name the phenomenon, and that is what a diagnosis is. Okay, so once your body starts generating symptoms, you have a diagnosis of a disease. In allopathic medicine, the foundational belief of that medicine is that once that happens to someone, that's it. They're going to have that disease. You know, for most diseases, they're going to have it for the rest of their life. You know, chronic disease, right? That means you have it for the rest of your life. And that there's really no particular reason why people develop disease. You know, acute disease is the cause of that is considered to be like viruses or bacteria or, you know, something like that, versus chronic disease in allopathic medicine. There's really no explanation as to why people get a chronic disease. Sort of like you're just bad luck, you know? Now things are blamed on genetics, which is just a scientific way of saying that you're unlucky, okay? So in allopathic medicine, it's sort of like, well, these things happen. We really don't know why. It's probably has something to do with your genetics, and the best hope that we have is to find chemical agents that will manipulate the biochemistry so that you can't perceive the symptoms that your body is generating, or we overpower the biochemistry that's generating the symptom. We sort of overpower it with an external agent so that the biochemistry that's generating the uncomfortable symptom can't happen anymore. So that's the framework that allopathic medicine operates under. Okay, so many people in America, because this is the dominant belief that we have culturally, the allopathic model of disease is the dominant cultural framework or belief. So I would say most Americans believe that this is true. I think the number of Americans that don't believe this is growing. But there are some of us that sort of intuitively, we don't believe that this is true. Okay. And I was one of those people. So, you know, I was raised in a very like Midwestern American home. I'm a Gen Xer. You know, I was a kid in like the 70s and the 80s. My parents are very conventional. They're not, you know, they were not like hippies on a commune or something like that. Suburban Chicago, upbringing, like nothing like wacky or out there. But I kind of had this just intuitive sense that this was not true. And when I started getting migraines and I went into my medical doctor, I thought that she was going to sort of dig into what was going on, because intuitively, though, knew that I was probably getting these migraines because of something that I had control over. Not that I did it to myself, right? But if there was something not right, there was something off, there was something, just a little untuned. And if, an expert like a doctor could guide me, could figure out what it was that was, kind of missing or lacking or, something that I was doing that I could stop doing, something that I could change that would improve how my body functioned. I thought that's what doctors did. So I had this intuitive sense, right, that there was something that I had control over, that there was something I could do, that there was something causing this. Hi there. I want to jump in real quick and tell you about my client, Beth. She was getting 15 to 20 migraines and headaches per month. And as you can imagine, this was impacting her work performance and her confidence. She also has 2 small children, and she was starting to feel like she was a horrible mom because she had nothing left for them at the end of the day. But she reached out and she booked a free consult call with me, and after I asked her about her migraines and her health history, I felt confident that I could help her. I help women uncover the root drivers of their migraines and follow a step-by-step plan to dramatically reduce the frequency by up to 90% without adding more medication or taking a bunch of supplements. So we built her personal migraine map, followed the plan, and now she will get 1 to 2 migraines per year, which she uses ibuprofen to treat if she needs to, versus up to 15 to 20 per month when we first started working together that weren't responding well to any medication. She just reached out to tell me that she got a promotion at work, she's on top of her career again, and has been able to come off all of her migraine medication. But most importantly, she's a confident mom again, and she's attending birthday parties at Jump Zone with her kids and saying yes instead of saying maybe later. I've worked with women like Beth from all over the United States who were told, this is the best we can do, but they were still willing to dig deeper. So if you're serious about changing your migraine story, go to drlesliecaesar.com/apply or tap the link in the show notes, and on our free consult, we'll map out why your migraines keep coming back and the first 3 steps you can take over the next 30 days. I do cap new client spots each month, so if the calendar is full, the doors are closed for now. But if you're done feeling helpless and ready to do the work to heal, pause this episode for 30 seconds and book that consult call now. And that if I went into my doctor, the doctor would dig in and she would investigate things and ask me questions, and we'd probably run some lab work or something, and then she would tell me, oh, you need to do this, you need to change this, but this is why this is happening, and this is what you can do. I had this vague intuitive sense of this, right? And probably I wouldn't have been able to articulate it very well at the time, but there was some intuitive sense like that, because when I went in to my medical doctor and she spent, the 10, 12 minutes with me and then handed me a prescription, I was pretty shocked. I was pretty surprised. It didn't meet my expectations of what I thought was going to happen in that appointment. If you're listening to this podcast, you're probably sort of how I was, right? You kind of have this intuitive sense that, there's something causing the migraines. It's not just genetics, right? But there's something that if I just knew what I could do, what I could change, right? There's something that I have some level of control over here that, if my body was functioning better, I would feel better. I would have fewer migraines. So what is it, right? And more Americans are coming around to this line of thinking around their health, which I will tell you from my own personal experience, not only with myself, but with clients, right? The allopathic conception of disease is incorrect, okay? The naturopathic conception of disease, I'm not going to say is 100% accurate. I'm always going to leave room open for new learning and new discovery, but it is profoundly more accurate than the allopathic conception of disease, okay? Because when you intervene, when you understand the symptoms that the body's generating, and you know how to intervene, and you know how to address what the body needs, the body responds and starts functioning better, and then we feel better. And this happens over and over and over again. Just because millions of people believe something is true doesn't mean that it's true. You can determine what is true if I do something and then this outcome proceeds from there, right? It starts to give us some clues as to what is true. This is part of the scientific method, okay? A lot of people have this conception that naturopathic medicine is not scientific. I can't tell you just how scientific naturopathic medicine is, because when I go in, I start working with a client, I have an incoming hypothesis as to what is causing their body to generate the migraines, and that hypothesis is continuously being tested, because based on the hypothesis, I'm going to make a recommendation, and my client is going to implement that, and then we're going to see what happens as a result. And if the body starts feeling better and the migraines improve and the other symptoms start to improve, that's a pretty good indicator that we're moving the body towards health, and that the recommendations that were based on the hypothesis, right, it validates the hypothesis, the going in hypothesis. And sometimes I will make a recommendation based on this incoming hypothesis, and the migraines don't improve, the other symptoms don't improve. Well, what does that tell me? My hypothesis going in here isn't correct. What do I need to adjust, right? How do I need to adjust this hypothesis? And then how are the recommendations going to change as a result? And then we see the outcome, right? So this is the scientific method at play when it comes to our own, human body, biochemistry, right? Healing journey, whatever you want to call it. I can tell you, right, the naturopathic model is much, much, much more accurate than the allopathic model. And we can see the fruit of the allopathic model when we give these external substances we call drugs and medication, when we give that to people. So in an effort to either prevent the person from experiencing the uncomfortable symptom, or to alter the biochemical processes within the body so that the body can't generate the symptom, we see the fruit of that, and that is worsening of the condition. I have done so many podcasts on this. I have a free training on this. When you suppress symptoms, because that's what you're doing, you're suppressing the biochemistry of the body. Listen, we may not like the symptom. It may be extraordinarily uncomfortable. We may be suffering quite a bit from the symptom, but the body is generating that symptom in response to the environment that it's in. If the body is in an environment where it doesn't have everything that it needs to function properly, it's not going to function properly. It's going to adapt to a less than optimal environment, and the trade-off is what we call symptoms and discomfort. So when you alter that process, you are further diminishing the health of the body. You are further impeding the proper biochemistry of the body, and the symptoms are going to get worse and worse over time. I have a hobby, and I like to listen to YouTubers, like content creators that create content. And one of the content creators that I like to listen to, she has shared that she's a migraine sufferer. I knew that she was taking Nurtec as her migraine abortive medication, and she probably started taking that about a year ago. Lo and behold, right, a year later, she was kind of working on her craft and just kind of talking about her life as she was working on it. And she said, well, this has been a hard week because, as I've talked about before, I suffer from migraines, and I have been taking Nurtec for the past year, and it had been working so well for me. But this week, I got a migraine, and I took my Nurtec, and I could tell, this isn't working like it used to. Oh no, now what am I going to do? And she just described the classic thing that we migraine sufferers go through when we suppress symptoms, right? All these, quote unquote, miracle drugs, they come out, and for most people at the beginning, they are very effective at suppressing the biochemistry of the migraine. But over time, our body says, you know what, I got to keep functioning in this less than optimal environment, and now it's even more less than optimal, so now I've got to figure out how to keep making these migraines, and then the drugs stop working. I mean, it was like a textbook scenario that I have talked about so many times on this podcast, I have a free training dedicated to this phenomenon, right? It's a recurring phenomenon. So this is the fruit of the allopathic model. Worsening of the symptoms, worsening of our health, right? I feel so much for this woman. I mean, what are you going to do now? Now we're talking Topamax. We're talking, right, preventative medication that we're notorious for making people feel worse, okay? So, you can judge the tree by the fruits. And again, allopathic medicine believes that there's really no rhyme or reason for your migraines. How many of you have gone into your neurologist and asked, can you just tell me why I have these? And the neurologist looks at you like you're crazy. Why are you asking me this question? We don't know why you have these migraines. Probably genetic, right? Who knows? Just quit bothering me and take your prescriptions. That's the response that I got from my doctor, right? So if you believe that the migraines are occurring because you're unlucky and there's really no rhyme or reason, it's just one of these, mysterious chronic diseases, and there's nothing you can do to alter the course of this. If you believe that to be true, it makes total sense to administer a drug or a medication to try to shut off the biochemistry behind the symptom. It's highly rational. It's highly logical. Our behavior is driven by our underlying beliefs. And so if this is the underlying belief as to why we get sick, why we develop a chronic disease, this approach that we Americans have all been suffering under, allopathic medicine, right? That approach is highly rational. But what's the fruit? The fruit is worsening disease. Americans are much sicker than they were when I was born in 1972. What is the fruit? The fruit is not that people are healthier and feeling better. The fruit is poor. The belief is the underlying assumptions. The belief driving this is false. It's incorrect. Okay. So I say all of this to set the stage for what I want to go through when I share this article from Migraine.com. Okay, very good. So this article, it really caught my eye. Like I said, I'm on their mailing list, and so they mail out to their list multiple times a week. And I like to stay on top of what migraine sufferers are being told. The article is, How Do I Process Grief Resulting from Migraine Disease? Okay, now, this is a very, very real phenomenon for chronic migraine sufferers. There is a tremendous amount of grief that migraine sufferers experience, okay? Because migraines are literally removing us from our life, okay? So, we're missing things like, maybe a coffee with a friend. We're missing big things. We're missing weddings. We're missing vacations, right? I have taken vacations and laid in bed for a day out of the, 6-day trip. I'm in bed for one day with a migraine, right? I've experienced, right? We're missing accomplishments. I can't tell you how many women have told me over the years, I don't really enjoy what I'm doing. My boss is is a total moron, but I can't look for another job, not with these chronic migraines. I would never want to do this to my next employer because I can't participate. I can't contribute 100%, and I would never want to do that. I have too high of ethics to do that to another employer, right? The grief, the loss, right? Grief is an emotion that's generated when there's a loss, right? And so if we can't attend our daughter's wedding, that's a tremendous loss. If we have to cancel with friends over and over again, right? There's, I couldn't go to the coffee. I couldn't go to the movie. I couldn't go to the night out. I couldn't go on the, on the girls' trip, right? All of these things are losses that we experience, and grief is the emotion that's going to be generated. So absolutely, grief is a very, very common emotion that chronic migraine sufferers experience. When I saw the title, I was like, oh, let me read this because this definitely hits home. Tom Picerno is the author here. And so he says, few events in my life have caused me to carry a burden of grief. The passing of a loved one, a friend, a pet is a common event that comes to mind for most people, right? Of course. But again, right, with chronic migraines, we know the grief that, somebody that doesn't have chronic migraines, they're going to think, the loss of a pet, a loved one, that's grief. Right? It's a whole nother level when you have chronic migraines. Migraine disease has caused me to experience a loss due to its impact on my life. Absolutely, right? For me, migraine has been a slow goodbye to many aspects of my life. Yes, yes, absolutely. This has taken me through the typical grieving process, which was sometimes painful as it settled into reality, right? So then we go into, when did I experience denial? Okay, so now he's kind of pulling in the stages of grief. While in my episodic days of the disease, okay, I lived in the first stage of grief, denial. Okay, so again, let's look at the framing here. And again, I can't emphasize enough, this is not a criticism of the author. I totally understand where he's coming from. I have the utmost compassion for him. I'm not criticizing him or where he's coming from, okay? But while in my episodic days of the disease, right? So what he's describing here is how most migraines progress, right? When we first start getting migraines, they're not that frequent. In medical language, it's like episodic. So, get a migraine a couple times a year, once a month, right? They don't happen that frequently. And when they don't happen that frequently, a lot of times we don't realize they're migraines, right? Like he said, I would write off my attacks as bad headaches, right? So a lot of times we don't realize that it's a migraine, right? We think, wow, that was a crazy headache, right? Or, that's funny. My head hurts kind of like how it hurts when I get the flu, but I don't have the flu. Like, what's going on, right? And he says their frequency wasn't impacting my daily life. And this is how things go, right? If I'm just having a migraine a couple times a year, I go, whew, wow, that was bad. That was horrible. I don't know what that was. But once the migraine remits, once it lifts, and our brain fog goes away, right? The clouds part, we kind of feel, right? We just feel like ourselves again. And we kind of forget about it, right? We say, well, that was horrible, but hey, you know what? Hopefully that doesn't happen again, right? Like, As they get worse, right? And we start saying, well, I guess if this only happens once a month, I guess I can get through it, right? I can kind of cover. I've got enough sick days. I can, hide out in my cubicle. Like, this is how I was, because I, would get them at work, and I was in like a corporate cubicle environment. So it was like, okay, let me just kind of lay low here in my cubicle, right? And just kind of wait till 4:00, and then I could try to get home, right? So that's sort of the denial aspect. Now, what he is describing as denial is a little bit different than what I would describe as denial, okay? So as he continues here, okay, let's unpack this. So he says, I would write off my attacks as bad headaches, and their frequency wasn't impacting my life daily. I treated them with over-the-counter pain relievers and pushed through. And this is exactly what most people are going to do, right? They're going to take some Advil, and they're going to take a nap, and they're going to probably, at the beginning, you wake up feeling pretty good. Now he says, I was unaware of the dangers of leaving this disease alone to progress. I kept telling myself and those around me, it was fine, or I'm fine. As time went on, the disease progressed and impacted my life for days at a time. I knew I needed to get checked out by a doctor. Okay, so again, this is the standard progression. They're episodic. They don't happen that frequently. They're not impacting us that much. We go, that was bad, but oh well, feel better now. Well, I took some leave and took a nap. I guess if I have to do that, once a month, it's not ideal. I wish it wasn't happening, but right, it's not significantly impacting our life. The denial, right, he says his denial made him unaware of the dangers of leaving the disease alone to progress, okay? So, again, I want to highlight some of the underlying assumptions. I want to highlight some of the underlying assumptions. He's already called his migraines migraine disease. I was unaware of the dangers of leaving this disease alone to progress. Okay, so again, the allopathic medical model, the allopathic conception of chronic disease is once you get it, you're stuck with it, and it's only going to get worse. And you can hear that in what he's writing here, okay? So let's keep going. When did the anger come? I never looked forward to going to the doctor, but I thought this was probably nothing. One visit led to another and another for me with no definitive answers. Again, in allopathic medicine, they don't believe you have the migraines really for any reason other than bad luck. So you're not going to get definitive answers. That's what I went into my doctor thinking I was going to get definitive answers. People go to a neurologist thinking they're going to get definitive answers. People go to the Cleveland Clinic and Mayo and headache centers thinking they're going to get definitive answers. You're not going to get a definitive answer within allopathic medicine because they don't think you have the migraines for any other reason than you're unlucky. It was time to seek out a headache specialist. Okay? Then I got my diagnosis of intractable migraine and new daily persistent headache, right? Oh my goodness, right? So yes, if your body is giving you these early warning signs of, a headache every couple months, other symptoms, and again, most Americans have a whole host of symptoms that they don't even think are symptoms. They just think it's normal for their body to feel this way. Those are early warning signs that your body doesn't have what it needs to function properly. Now, when our body doesn't have what it needs to function properly, thank goodness, we just don't drop dead. The beauty of the body, the miracle of the body, is that it will adapt to less than ideal conditions, a less than ideal environment. But that adaptation to survive in less than ideal conditions comes with some trade-offs. That's what we call symptoms, okay? So unfortunately, because I'm assuming he's an American, the typical American, the way that we were all raised, the way that I was raised, we don't realize this. We don't realize that those episodic headaches and migraines, that's the early warning symptom, the early warning sign. We do go into denial. We totally go into denial all the time. It's not that bad. Well, I feel good today. Well, if it's only going to happen once a month, I guess I can live with it, right? Our denial prevents us. He's saying from getting on more medication. I'm saying from intervening and taking the steps that we can take before the problem gets even worse. Okay? So unfortunately, his use of over-the-counter medications, then going into the doctor, I'm sure he got prescriptions, right? Probably Imitrex or something like that, or Triptan. Unfortunately, because those medications were further altering his biochemistry, not really addressing the underlying issues, it got worse and worse and worse. Absolutely. That's what's going to happen. Until the point that he had daily head pain, okay? And about half my clients have daily head pain. This is an absolute real thing that happens to people all the time when they follow the allopathic model. So again, what is the fruit of the allopathic model? Intractable migraine and daily persistent headache, okay? So by then, I was also firmly entrenched in a medication adaptation headache cycle that needed to be broken. Fancy medical terminology for rebound, right? The dreaded rebound that all migraine sufferers are working so hard not to get into. The dreaded rebound. I was angry by the diagnosis or the outcome of these conditions. Yeah, absolutely. That anger is usually the catalyst, okay? It was my shock and anger of going into my doctor thinking I was going to get answers and only leaving with a prescription. It was that shock and anger that jolted me out of the allopathic model, out of the allopathic mindset. I already had that kind of intuitive knowing, but that anger, shock and anger, what do you mean? This is it? 10 minutes and a prescription? What? That anger jolted me out of the false conception that I had about my migraines and my headaches. And that anger is what drives overwhelming majority of my clients to reach out to me, right? It's like we finally get to the point where we're like, you know what? Now I'm mad because I followed all the recommendations. I did everything they told me to. And now I have daily persistent headache. And now I'm in a rebound. And now you want me to do a cold turkey withdrawal, right? It's that anger that is ultimately beneficial to us, because it gets us out of this false model that's not going to help us. So let's continue here. I was angry by the diagnosis or the outcome of these conditions. There is no cure for them currently. Right. You cannot suppress your way out of this problem. It's never going to work. Look at the outcomes. Look at the outcomes over decades and decades and decades. Things are getting worse, not just for people with migraines, for people with all sorts of chronic conditions. The fruit is rotten. This approach does not cure anything. It makes it worse over time. Absolutely. That frustrated me. Well, yeah, of course. I resented the illness because at that time I felt I was to blame for not caring for myself. Now, here's where people get angry, and this is the number one reason why people will not shift out of the allopathic model into the naturopathic model. Because inherent in the naturopathic model, if there is some underlying root cause, and I can take some action to address those underlying root causes, and if I do that, my body will respond and it'll start to feel better. This reality actually makes a lot of people angry because it sounds like we're to blame. And right, because if migraines, if there's no reason for it, it's genetics, I have no control over that. It was sort of just, the roulette wheel that got spun, universe's roulette wheel. There's nothing that I can do. Then there's nothing that I did that caused it. But there was things that we did that impacted our health. We may not have been aware of it. Had we known better, we may not have done it. But let's face it, we self-sabotage ourselves all the time. I mean, even if we did know, maybe we wouldn't have been able to implement those changes. Maybe we wouldn't have been able to muster up what we needed to do to take better care of ourselves. That happens to us all the time. It happens to me. So within the concept of disease that naturopathic medicine holds, we do have some responsibility for how we are feeling. And that hurts. That hurts. That can feel a little rough. But if we don't have any control over how we're feeling, then we can't make any changes and feel better. So the allopathic model, which is you just got, cosmically unlucky when the roll of the dice was thrown at conception for you, then we have nothing to blame, but we can't do anything about it. Those two things go hand in hand. Versus in naturopathic medicine, the body generates symptoms when the conditions are not optimal. The miracle of our body is that when conditions are not optimal, we just don't drop dead. We can adapt to less than optimal conditions, but there's trade-offs. Well, who generated the less than optimal conditions? Some of those things we had no control over, but some of the things we did have control over. Some of the things that were not optimal, we had control over, but we, maybe for lack of knowledge, maybe for lack of motivation, maybe, unconscious mental and emotional factors, we weren't able to create a better environment. So there is a little bit of conviction within that model, but because of that, we can actually change, we can do something different, we can give our body what it needs, and we can feel better. So within the naturopathic model, you have to have that little bit of, a little bit of conviction in order for the change to take place. And in this article, I resented the illness because at that time, I felt I was to blame for not caring for myself. That's not the case at all. But at that moment, I was dazed. So there was a little bit, again, I can't read his mind, but just sort of reading this and knowing what I went through personally, knowing my own mind, right? When we have that little intuitive sense, I think there's a reason for this, and I think if I knew what to do and if I could do it, I'd feel better. Ooh, flip side of that is, I must not have done the best thing for myself in the past. Ooh, that hurts, right? From what he's describing here, again, I can't read his mind. I'm making an assumption, maybe incorrect, but he seems to be describing here that little intuitive knowing. And that little intuitive knowing, it comes with a little discomfort. It comes with a little bit of a punch. But you got to take that punch in order for there to be the ability, the capability, the possibility that you could take different actions, you could care for yourself differently, and feel differently. Do you see that? You have to have both. Right? You got to have the little bit of the gut punch in order for the possibility for you to feel better, to be there. So again, I'm presuming here, but it seems that he had that little bit of inkling, but because it hurts, maybe he kind of pushed that down. Because in the allopathic model, if you're just unlucky, if you're just sick because you're unlucky, bad genes, it's not your fault, but there's nothing you can do. So which one do you want, right? There's nothing it's not your fault, but it's nothing you can do. Or, I could do something differently. Maybe I could have made different choices. And if I do now, I will feel better. Which one do you want? So when did I overthink and feel anxious? Okay, so he says, this was a problem I needed to solve, I told myself. I spent many hours playing the game of if I would or should have done. The overthinking was consuming me. When I could stay focused, all I thought about was these illnesses. My attack cycles were brutal and were now spanning weeks at a time. I was missing work, missing out on life. I was anxious about the next attack. When would it come? How long would it be? Was I ever going to gain some control in my life again? Okay, so this is absolutely what chronic migraine sufferers do. Now it's called Dr. Google. Okay, let me go on Google, right? I got to have answers. I got to investigate, right? We drive ourselves crazy looking for answers. And again, this is that intuition, that little intuitive spark that says, you know what? There's an answer for this. If I could do something different, I would feel better, right? And we just try to figure it out. So again, I can't read his mind, but it seems like this stage that he's describing, there was a little bit of him sort of trying to figure out what could I do differently, because if I can do something differently, I could feel better. Hi there. I want to jump in real quick and tell you about my client Beth. She was getting 15 to 20 migraines and headaches per month, and as you can imagine, this was impacting her work performance and her confidence. She also has 2 small children, and she was starting to feel like she was a horrible mom because she had nothing left for them at the end of the day. But she reached out and she booked a free consult call with me, and after I asked her about her migraines and her health history, I felt confident that I could help her. I help women uncover the root drivers of their migraines and follow a step-by-step plan to dramatically reduce the frequency by up to 90% without adding more medication or taking a bunch of supplements. So we built her personal migraine map, followed the plan, and now she will get 1 to 2 migraines per year, which she uses ibuprofen to treat if she needs to, versus up to 15 to 20 per month when we first started working together that weren't responding well to any medication. She just reached out to tell me that she got a promotion at work, she's on top of her career again, and has been able to come off all of her migraine medication. But most importantly, she's a confident mom again, and she's attending birthday parties at Jump Zone with her kids and saying yes instead of saying maybe later. I've worked with women like Beth from all over the United States who were told, this is the best we can do, but they were still willing to dig deeper. So if you're serious about changing your migraine story, go to drlesliecaesar.com/apply or tap the link in the show notes, and on our free consult, we'll map out why your migraines keep coming back and the first 3 steps you can take over the next 30 days. I do cap new client spots each month, so if the calendar is full, the doors are closed for now. But if you're done feeling helpless and ready to do the work to heal, pause this episode for 30 seconds and book that consult call now. Now, the problem is, the typical person, you're not going to figure this out, okay? I've dedicated my life to figuring this out. I am continuously learning more and more all the time, okay? So this can be very draining for people, the constant searching, okay? If it were on Google, everybody would feel good, okay? Again, what's going to be on Google is going to be heavily, heavily oriented towards the allopathic model. And like I've talked about on the podcast, just because you're taking a natural substance, it can manipulate your biochemistry just like a drug. And that's what most natural practitioners are actually doing. They are using natural substances like drugs or medication and just manipulating your biochemistry. But people think because it's natural, it must be improving their health. And that's not necessarily the case, okay? So again, what's very typical for people is they're kind of driving themselves crazy, right? They're draining themselves tremendously by trying to find these answers on their own. Why? Well, they went to the headache clinic, they went to the neurologist, right? Why, doctor, why do I have these? I don't know, right? So it's like, okay, let me figure this out. It's going to be very, very difficult. But this is probably what has led you to this podcast, right? Trying to get this figured out. So, many of you listening might be experiencing how draining this is. And then certainly the anxiety, right? This is what I call the post-traumatic migraine response, right? Okay, I'm feeling good now, but is the sun too bright? Are we going to have a storm come through? Oh no, I got the presentation at work. Am I going to get a migraine, right? It's like constant worrying. And, what's going to tip me into a migraine? How do I protect myself? I got to wrap myself in bubble wrap, right? It's a whole thing, right? And so then he thanks his wife, right? So he's got a supportive spouse who came to all of his appointments, has advocated for him, stood up for him, right? That's wonderful if people have that. When did depression enter my life, right? Time slips away quickly with this disease. Absolutely, right? How many hours are spent in bed in a dark room, right? Not 100%, white knuckling it through the day, right? Time does slip away very, very quickly. And so then depression, right? Very common phenomenon for chronic migraine sufferers. I hated having the constant feeling of helplessness and disappointment. My life was drained out of me as a result of this disease. I was losing hope that it could ever be refilled. Even today, depression and anxiety sit inside me. They are treated as comorbid migraine conditions. Using combination therapies have been very helpful in managing both migraine and my different needs. So again, for most of my clients, part of the recovery from migraines is recovering from this post-traumatic migraine response. I had to go through this. I've talked about this on the podcast. Even when people restore their health and their body stops generating the migraines, maybe they haven't had a migraine in a very long time. Maybe they've gone from daily migraines to getting, a headache once a month, right? Significant improvement. Even with that, we will still fear getting a migraine. We will still bubble wrap ourselves because that's what we're so used to doing. So with my clients, most of my clients, we are consciously working on recovering from the anxiety and if it's there, depression that the migraines generated. Okay, so this is a very real phenomenon. And then have I accepted migraine? With more effective management, and again, what he's talking about here, I'm sure, is medications, okay? Preventative medications, right? This is called managing the migraines. So with more effective management, so, probably more and more preventative medication put on board because, again, as we've talked about, over time, you move through your abortive medication. Now the migraine frequency has become so much that you can't take that many abortives, so now you got to go on preventatives. And again, for most people, that first preventative, it works for a while, stops working. Now we need a second preventative, right? A third, a fourth, right? On and on and on. Mindfulness and reviving my self-compassion were excellent tools. I started to rebuild my life. It was different for me since I had never reinvented who I was or this much of my life. The positive self-talk helped me to be okay with being vulnerable and tolerate my emotions. I developed coping skills and my self-portrait looked better. I was once again good enough and ready to begin living in my new reality, my new normal. It was still really good most days, but different. Most of my previous life had been laid to rest. Okay, so I'm happy that he's in a better place mentally and emotionally. Have I fully grieved and rebuilt my life? Healing has come at many levels for me since my journey has begun. it's so interesting, right? We talk a lot about a healing journey and so on. It's kind of like a meme, kind of like a stereotype. I've had clients tell me, right, that have gone from, daily head pain to maybe having a headache a couple times a year, life-changing. I've had so many clients tell me healing, part of this healing process, it was working on so many different levels, and it was really a journey, and it was a journey of self-discovery, and it was, we had to work on a lot of levels to really get it right. Same language, different process, totally different result. Isn't that fascinating? Isn't that fascinating? I had worked through my grief stages and embraced the changes in my life. It wasn't easy rebuilding my sense of worth and purpose. I had chosen to live the whole life I could with migraine disease and all that comes with my version of it. I am not my illness. They do not define who I am. Hope is a driving force in my life again. I know a cure is coming one day. I hope I'm here to see it. Thanks for listening. We'll see you soon.